This topic is application of roll gauze elastic bandage. Indications for bandaging include promoting wound healing. An elastic bandage can reinforce compression on an affected area. That increases venous return, decreases edema, and also prevents hemorrhage. An elastic bandage can also be used to support a musculoskeletal injury, like if you have a sprained ankle, and a gauze bandage can secure a dressing in place. It supports the dressing, protects the wound, and also allows for air circulation. Types of bandaging turns. When you hear the term turn, I actually want you to think of how it goes around the body part that we're wrapping or bandaging. Here are all the different types. Let's start with the figure 8, which you can see here in this image. This supports or immobilizes an area of injury. This is oftentimes used on an elbow or a knee or an ankle. This type of bandaging starts with 2 circular turns. Then it goes above and below the affected joint in a figure 8 pattern. It finishes with 2 additional circular turns above the injured joint. This image shows a figure 8 compression dressing used for an above-the-knee amputation. Circular turns are simply going around the affected area. Most of our bandaging techniques start and finish with circular turns. Recurrent turns are used for distal areas, like the end of the fingertips or the top of the skull. It starts with 2 circular turns, and then you fold over upon yourself back and forth over that end of the affected area. And then you finish it again with 2 circular turns. Spiral and spiral reverse turns. We're going to talk about those in the next slide. Spiral bandaging is demonstrated in the image here. It is normally used on a wrist or arm or leg where the entire area of the body is cylindrical. This type of bandaging starts with 2 circular turns and then slowly spirals or progresses upward. It normally overlaps 1/2 to 2/3 of the width of the bandage. Spiral reverse bandaging is a variation of the spiral bandaging. It's used for those areas that may start small and get bigger, sometimes on an arm or a leg. You start with 2 circular turns, and then as you progress up, much like spiraling, instead of just continuing with that plain spiral, you're going to go around, flip the bandage, wrap around, and flip it, and wrap around, and flip it. The twist of the bandage makes the fit more uniform along the extremity. You'll be left with a chevron pattern or a V pattern in the bandaging. Nursing interventions for when we are applying a bandage for a client include pain medication. By us manipulating that extremity or that affected area, we could cause pain. So we might want to anticipate that and make sure that the client is comfortable. We want to make sure we're using the appropriate sized bandage. Too small may not provide enough stabilization or cover the area that we're bandaging. And it could also interfere with circulation if it's too tight. Too big of a bandage may also provide inadequate support for the client, and it might affect circulation. If we're wrapping that affected area to help promote venous return, if it's too big, well, then it's not doing what we want it to do. We always want to check for skin breakdown. We want to look and make sure there's no areas of irritation or redness. We also want to check those bony prominences to make sure those are guarded too. Anytime we're changing or applying a bandage for a client is a great opportunity that we can teach the client, family, or caregivers the proper technique for applying bandages. Additional nursing interventions include how to apply the bandage. You're going to want to go distal to proximal, and then you want even distribution of tension along the entire bandage. If it's possible, you want to keep the distal end exposed so we can do our neurovascular checks. We'll do our neurovascular checks before, during, and after our bandaging. We want to check for temperature, pulses, if they're having any tingling or pain. If, while we're bandaging, the client experiences any of those, we want to remove that bandage. If those issues are not resolved, we need to contact the healthcare provider.